Skin cancer is the abnormal growth of abnormal cells of the skin that have developed as a result of damage, usually by the sun. There's many different types of skin cancer. The majority of are quite easily treated, but it does require surgical interventions and potentially other therapies, so it's best to avoid it. But most times you will be seen, it can be removed surgically, and then you'll be assessed for other therapies if necessary. Most skin cancers are quite beatable. It's important to keep an eye on your skin and know what your skin looks like. If you are developing new moles or have changing moles, if you have lesions that are not healing or sores that continue to bleed and itch, those are things that should be evaluated by your family physician. The best way to protect ourselves from skin cancer is to avoid exposure to the UVA and UVB rays. We ask people, the most importantly, is to apply sunscreen. When it comes to SPF of the sunscreen, most studies would recommend that an SPF of 50 would be sufficient. It's more important to reapply your sunscreen multiple times throughout the day, usually every 3 to 4 hours. And don't forget your sensitive spots, like the tips of your ears, your nose, and your toes. Those are generally forgotten. The sun is strongest anywhere between 11 o'clock and 3 o'clock, so we generally recommend to stay away from the sun or sit in the shade at that point. Shade is helpful, but it only reduces your risk of UV exposure by about 30%, so you still should put your sunscreen on while you're sitting in the shade. And then be careful when you're on the water. The water is a reflective surface, so we get a lot of extra exposure to UVB and UVA rays. Don't forget that in the wintertime you can also get sun damage, and it's important to wear your sunscreen. The snow is a reflective surface, so it can act just like water and increase that exposure to your skin. Some of the ways that can also increase your risk of skin cancer is certain medications can increase your risk, as well as tanning beds are still unfortunately a problem that can increase your risk of skin cancer as well. Being out in the sun and enjoying the weather is actually a great thing. It's great for our mental health, it's just great for our overall health overall. And a little tan here and there is not bad. It's more about the chronic burns and the chronic damage. So wearing an appropriate SPF, you should still get a little bit of color, but avoid the overexposure. Have a great summer and protect yourself.